Good. So that that demonstration would be on the side lying lower back and hip. Yeah, it will be a combination of these. So as always, as we did before, you're looking at putting your clients in the right position, having the pillow, lift your head, thank you, a little bit more forward. So a big recess of the pillow would be in front of the client. Yeah, see that all is supported. Put that in between. Good. And then this time we're going to need another pillow, another towel. So we're going to have the same tea towel technique. That. And then this towel we are just securing on the underwear, and now we are ready. If you look at this area, the bony landmarks that we have is the iliac crest. Above that, deep here, in that very small space, we have the Quadratus lumborum muscle that is deeper, and more superficial we have the erector spinae. The erector spinae does continue on the sacrum, and there is a good need to massage the sacrum as well. Yeah. Below the iliac crest, this is the gluteal maximus going this way. More to the side is gluteus medius and minimus, and really in front is the tensor fasciae latae muscle, and then all of them run into the iliotibial band. Actually, it's not correct because the link is between gluteus maximus that continue with the iliotibial band, and the iliotibial band all the way. Here we have the hamstring, and in front the quadriceps muscles. Yeah, ribs, all the diaphragms also may relate to. Yeah, and you can see how the diaphragm and the quadratus lumborum muscle may be more or less linked almost. Yeah, because really the quadratus lumborum finish on the lower two ribs, and that's where the diaphragm end. So you can see how, say, people who are breathing either tensely or incorrectly, that may relate to the stiffness here, may relate to back ache as well. So everything is related. The flexibility of the ribs, the flexibility of the hip would relate to problem in there. Okay, so how do we massage the back? I will ask you to come to the other side. Yeah. Okay. So what we are doing is asking their hands to be there, and you having a nice way to massage. This is how we do the draping. Yeah. Can I undo the bra? Yeah. Good. And then you are really ready for that. Can I use this oil? Or?
Yeah, that's fine.
Okay. So you're using that draping. Okay. So you can come from this position, one hand on the shoulder and one hand on the spine. This is really the effleurage that you do. So a lot of leg work. Good. Now, because you're coming from the side, you can do this technique that you're holding your elbow onto your body and then pushing your body in. So here, I'm on the spine, and that's actually a bit of mobilization. Yeah? So someone who comes with an increased kyphosis, this technique would be really nice for them. Of course, you need to be careful that the bone integrity is strong. So any suspicious of osteoporosis or any bone disease, you don't do it. But it's really the minority of people would have it. Just be careful. Yeah. So I would not do it on a 67 years old who suspected having osteoporosis. Yeah? Okay. This is the first technique. The second technique, I'm really coming from above, and what I'm doing, I am finding the spine, the spinous processes of the spine, and then just lightly moving them. And it's surprising how you can put a lot of force if you go kind of above them, but when you go into each one of them, some of them quite tender. And what I'm doing, I'm individually wake them up. Yeah, okay. Let's see if they can move. Okay, so we have a case here of very tenderness. Now, do I feel anything different? No. I don't feel anything different, really. I may sometimes feel that it's stiff, yeah? But I need to work that. So as opposed to just do that and do a lot of these and, no hoo-ha. Just try to individually see where does it need. If it's too difficult for you, you can come from above. So am I coming from above it? Yeah, my fingers are quite comfortable. Good. Or you can come from the side. And what I'm doing, I'm holding these fingers, so the thumb's in one side and the finger on the other side, and then I'm moving it slightly. It's not going to be a lot of movement.
How is it, Fiona?
It's quite sore, the top ones, yeah.
Mm-hmm. So you can change it just to a finger. Good. Then if you want to work on the muscle itself, you take it a little bit to the side and then work here, like that. And then you can do knuckles. That area would tend to be on most of your glute tendon. That is related to neck and shoulder. So the area that is related to, say, neck problem really will end around here sometimes. You always need to look. Same in the lower back. Lower back is, you need to look here. It's always related area. Never leave it kind of untouched, because you see, she might come with a neck pain, but a lot of the tension is actually here. Okay, let's go a little bit to the lower back, and then I'll show you different technique. Maybe you can come to the both sides. So you need to come and feel the erector spinae from here. You can do it in two ways. First, you need to warm up that area. Here, I feel that it does need to be warmed up, so you need to come from above, petrissage it, yeah? You can do petrissage. Really nice, easy technique to start is rocking.
Nice.
Yeah, really nice. So you're holding the hip and you're rocking, and by then you're just really oscillating the muscles. And to be honest, I love this technique because can I really go deep into these muscles that are maybe second layer or third layer? I can't. So I just stretch them all together.
Can you mobilise a hip joint?
We're not in the hip joint. The hip joint is there.
Yeah.
What I'm doing is stretching the whole hip, or mobilizing the hip on the spine. Okay, so you can do that, and then you can come more into this area. Now that is variable technique because you do need to come that way, yeah? So if you feel that it's too much for you, either ask the client to come forward or sometimes raise your back leg a little bit.
But that is, what?
I'm on erector spinae.
Oh,
Do you see how I'm on erector spinae?
right.
On erector spinae. Here I'm now gluteus area.
Medium.
Probably maximus because I'm on the back a little bit, yeah? So you need to utilize your weight the best way. You can do it this way, or you can come from here and maybe do it this way, yeah?
Is it painful?
It's lovely.
Okay. Okay. Another technique, really nice, working on the sacrum with knuckles.
Directly on the
Directly on the sacrum. Now, why? There are still a little bit of muscles this way, and that's the origin. It's like working on the suboccipital area. I always tell you, yeah? It's really nice. Sometimes it's really the difference between no pain and pain. So you can work a lot here if you're not working on the sacrum, really deep, nice and slow and deep, then it would still would not release the tension. So you can work with your thumbs. And really stop in there. And then you can continue on the gluteal area itself. You can lean on that. Really check and see how. Any tenderness here? Okay, so you just stay a little bit and then really slowly moving just your arm. And that is enough. Reduce the pressure and increase it. Good. And then last one probably is Quadratus lumborum. I'll show you how you're coming from the front. It's just easier. You might need to take the towel a little bit more forward, that's it. And then come from the erector spinae. So this is a spine, erector spinae, and then you go further, and once in a while you're just checking it in, you're pressing in. So here I'm still on the erector spinae. I go, and I actually feel that there is a different tension. Yeah, so it might be the Quadratus lumborum, but just to check, I go further forward, and then the muscle kind of disappeared. I'm into the abdominal area. So I'm thinking, okay, I'm a little bit too forward. I go back, and that's where Quadratus lumborum. A lot of the time it will be quite tense, surprisingly. So you have very little space because it's in between the upper hip and the lower ribs. So you can do that, or you can do it with edge, and always checking with the client, you know, how things are. Is it tender? Quite tender?
Yeah, a little bit, yeah.
Okay. You can even maybe push so you can do a bit more stretches down, or if you want to have more space, you just take the upper leg down, just like that, yeah? And that means that the hip drops that way. That means that you have a little bit more space, yeah? And you can do that, and the same idea of then movement, oscillating it. Or even oscillating it to the side, you know? It's really just as a reminder to move. I think it's quite a lot, right? Yeah? Okay, so effleurage, working from the side, working on the spine, moving them vertebra by vertebra. You don't need a lot of force if you're gentle. Just tug it and move it. Yeah? And then Quadratus lumborum, hip, stretching it down.
Great.
Okay, good. We have about 15 minutes each group. Yeah? Thank you. You can close it now.